Hello everyone, welcome to Dr. Tuchai. In this video, we'll talk about orthodontic instruments that are used in placing in the brackets. So let's get started. So first, we will talk about the parts of the plier. So it has three parts: beak, and we can hold the plier with the help of handle. Now, how you will hold the different orthodontic instruments? There are two techniques. Like the first one is thumb and palm grip. Mostly we use pen grip during working. So now we'll talk about diagnostic instruments, like how you will start it, what you will do. So first of all, we will do diagnosis. So what you need for the diagnosis? Okay, you need instrument that are diagnostic instruments. So we will talk about it basically three diagnostic instruments we mostly need for the diagnosis. So the first one is mouth mirror, the second one is dental probe, and the third one is escape dental tweezer. So in this picture you can see all of the three diagnostic instruments: tweezer, dental probe, and mouth mirror. Now we will talk about the instruments that are helpful in placing the brackets. So before placing the brackets, we will talk about the instruments one by one, according to the placement of the brackets. Okay, so first, before placing the bracket, we need to create the space between the molars, like first molar, second molar, or maybe a molar and a premolar. So what we need is we need separators. Now first we need to create the space between the teeth, so we need elastics, but we need an instrument which will hold the elastics for the placement between the teeth. So we need this instrument, and designed to separating orthodontic pliers are designed to spread and hold elastics during the placement. You can see in the circle picture, you can see that is a plastic, and for holding that instrument we need a separator placing plier. So this is a plier which hold the elastics and place it between the teeth for creating space for the placement of the bands. So the second thing you need to know, now you have already created the space between the teeth, you can see. Okay, now you need to place the bands. So you have placed the bands, and for seating of the band you need this instrument. So this is a band placing instrument. Okay, it is a band pusher which push the band. Instrument you need is band seating instrument. So it is called a nylon band seater, and it is also called a bite sticks. They are used to place and adjust orthodontic bands. Band seaters allow patients bite to push the bands into proper position, which is where the name bite sticks come from. Okay, so now we have talked about the separator instrument, like we have created space for the placement of the band. The second instrument we talked about for the placing of the bands. Now we will talk about if we have placed the bands and that are not adjustable, so we need to remove the bands, or at the end of the treatment we need to remove the bands after placement. So we need instruments that can remove the band. So these are the band removing pliers, and there are different pliers like for anteriors and posteriors. This is one is plier is used for anterior band removing plier, and is used to remove the seated orthodontic bands that are placed anteriorly. Now we will talk about the plier which is used to remove the posterior band. So it is also called Oliver Jones posterior band removing plier, and has two beaks, you can see in the picture. First one, there is a plastic padded tip, and the beak below it is a sharp removing beak. The plastic head rests on the occlusal surface of the tooth, and the sharp tip below the gingival contour of the band. You can see in the circle picture. Okay, and it is used, you already know, it is used to remove the posterior metal bands with maximum patient comfort. Now we have already talked about the separator plier which is used to create a space between for the bands, and second we talked about the band placing instruments that are used for the placing of the bands, and the third we talked about we talked about the instrument which is used to remove the bands. Okay, now we need to place, we have of course we will again we need brackets. Okay, so for the placing of the bracket, what we need an orthodontic bracket card. It is used to organize and hold orthodontic brackets to facilitate quick placement. You can see in the picture each circle on the card corresponds to a particular tooth in the mouth. So now you have a bracket orthodontic card. So now what you need a holder to hold the brackets. So the bracket holder, it holds the bracket, and you can see the flat end of the bracket used to press the bracket into position for bonding. Now There are different types of bracket holder. Like you can see in the picture, it's a curved bracket holder and is used for the placement of lingual brackets. And you can see in this, it is a lingual bracket and a tube holder. So it is used for the placement of lingual brackets, tubes and attachments. Now we have already placed the brackets. What we need to do, like you have already placed a bracket but you don't know you have placed it correctly or not. Okay, so we need an instrument which is used for bracket positioning. So this instrument is called Boone's gauge or Boone's gauge. You can see it accurately measures the height of bracket placement from inside the ledge at 3.5, 4, 4.5 and 5 mm. So till now we know how to create a space between the teeth for the placement of the bands, and also you know what you like about the brackets, what is the instrument it is used to hold the bracket, and how you will measure the height of the bracket, like how you will position the brackets. So now you need to know like how you will place the wire. Okay, you need to place the arch wires. So this instrument is called a vine guard plier and is useful for placement and removal of the arch wires. Now we need instrument that will hold the wire within the bracket. So this instrument is helpful. This is a Matthew plier, and Matthew pliers are intended for holding, placing and tying ligatures or elastics. Okay, so this Matthew plier is used for tying of ligatures and elastics. So the elastic or ligatures can hold the wires within the brackets. You can see in this picture, this instrument is tying elastic around the wings of the bracket to hold the arch wire within the bracket. Now ligature, there are different ligature instruments. So you can see this is a ligature instrument and it is called a mosquito forceps, and there are two types, like straight and curved. It is used for placing elastic ligature and also tightening ligature wire. Ligature placing instrument is another instrument. It is used to perform various procedures during orthodontic treatment. It is perfect for easily threading and directing ligatures into brackets, or for pushing and directing arch or auxiliary wires into the correct position. You in this picture you can see it is a twister. So it is a twisting ligature wire, like you have already placed the wire ligature and you have directed the ligature in the proper position, but you need to hold it, you need to twist it so that it will not come out of the mouth. So you can see now you have already hold the bracket, the wire within the bracket with the help of the ligature wire. You have also twisted it, but now you need to tuck the end of the ligature, and there are different types like single end or a double end, and this instrument is called ligature tucker. Now we'll talk about the wire cutter. Okay, so this is a hard wire cutter. Hard wire cutters are made up of hard metal tips or tungsten carbide tips. These are heavier and larger than the pin and ligature, and these are used to cut all wires up to 0.02. Now, distal end cutter. Distal end cutter is exclusively useful for cutting the distal end wire that is protruding out of the molar tubes. You can see, and this instrument hold the cut arch wire so it does not fall into the patient's mouth. You can see in the picture that this instrument, there is a space within the a beak so that it will hold the wire, okay, and prevent the wire from falling into the patient's mouth. Now, Crew's dental end cutter. So it is similar to distal end cutter, and the difference between is a design with long body so it can reach the back into the depth of the mouth. It is used to cut the arch wires that are placed lingually. So that's why its name is called Crew's distal end cutter. Now this is also a cutter which is called PLC pin and ligature cutter. This instrument can also cut the ligature wires, and they are made up of stainless steel tungsten carbide and right to the tip for smooth cutting of soft ligature wires and lock pins and elastomerics. And ligatures up to 0.15 mm in diameter this instrument can cut. Thank you for watching this video, and like, share and subscribe.